Dear Diary, it's January 1st, 2019. Experiencing my college roommate attempt to shoot me and his girlfriend, but instead turning the gun on himself, still haunts me to this very day. I want to erase this memory from 1998, but it keeps resurfacing every time I hear a loud noise. This triggers what I experienced. Being easily startled has become a part of what defines me now. Having those around me knowing how and why I can't handle what I experience makes me feel more ashamed. At this day and time, I have this persona that I can handle stress, and if that reputation is tarnished, then they will judge me. I feel like being labeled with post-traumatic stress disorder, people will look at me differently. Saying out loud that I need help is too hard to bear, so writing makes it easier. Since I want to get better, I'm following the homework my therapist has set forth in my plan of care, which is journaling. By writing out my feelings, this allows me to work on expressing the feelings that I had been suppressing for so long, which has helped me tremendously. This morning was more difficult than most. Last night was New Year's Eve. Firecrackers reminded me too much of that day. My heart starts racing. My insides turn warm, my vision narrows as though I'm running down a tunnel of quicksand. Then I can feel panic set in, spreading like wildfire, making it harder and harder to breathe. I know where the noise is coming from, but it doesn't help mask the effects I'm feeling. The aftershock of the sounds vibrates through my body, putting me back into that bedroom when he shot himself in front of me, only 4 short feet away. Last night's celebration was much more severe than regular days living with this disorder. Holidays involving fireworks are not my favorite. Getting back on track is taking a little bit longer than usual this morning. Getting dressed was difficult because I did not want to get out of my safe bed. Brushing my teeth, showering, and putting on makeup felt like hours passed by, but the clock only moved an hour forward. After a night like this, I am more on edge in the days to come because I am anticipating leftover fireworks to be used. Even after this holiday dissipates, occasional loud noises such as breaking of a plate accidentally, slamming a car door, and even something simply as someone yelling can trigger my emotions. I am constantly, unconsciously on guard. The dysfunctional regulation of hormones located in the hypothalamic pituitary adrenal axis is the best way to describe this complicated neurobiological concept. One event initiates or triggers a sequence involving serotonin levels, neurotransmitters, increasing dopamine and norepinephrine, which is a part of the sympathetic nervous system. This results in negative behavioral changes that leads to spikes in the vital signs, thus activating symptoms that is defined by this illness. Witnessing or experiencing a traumatic event, such as an assault, a natural disaster, serving in the military, that poses a near-death experience or threat of serious harm manifested into a disturbing pattern of behavior is the best way to define PTSD. The stigma that surrounds this disorder is that it's just specific to military personnel, which is untrue. One aspect they all have in common is tragedy. PTSD has evolved into its own category of or from anxiety disorders due to the fact that PTSD has to have an underlying causative trauma prior to becoming diagnosed with PTSD. To understand how this individual will handle the stress of the situation, we could examine factors such as the living environment, family structure and surrounding support staff, and even history of behavioral patterns. And this is true also with adolescents. This disease does not discriminate against race, age, gender, ethnic background, or even culture. Traumatizing events suppressed over time can resurface at any moment. and it can span over an uncertain amount of time. Treating the individual immediately after the said event can reduce the risk of this turning chronic. 3 components make up PTSD: hyperarousal, being on guard all the time, re-experiencing through dreams, flashbacks, and outside triggers, and exhibiting emotional numbness by becoming isolated from others. And this also matches to the signs and symptoms: agitation, depression, hypervigilance, self-destruction behaviors, nightmares, severe anxiety, and even self-harm. Like all other mental health disorders, a second diagnosis of substance abuse follows the primary diagnosis. A combination of therapies of one-on-one therapy, such as grounding therapy and exposure therapy, combined with pharmacological therapies, are offered to increase the effectiveness of the person living with this day to day. Anxiety medications, medications that treat insomnia, and antidepressants are the top choices that combat these symptoms. According to the U.S. Department of Veteran Affairs, while benzodiazepines are not recommended medications and aid to treat this disorder, they are prescribed to promote regular sleep patterns and decrease anxiety. Anybody suffering from this disease has plenty of outlets and resources there available for you. Some of those are National Suicide Hotline, U.S. Department of Veteran Affairs, National Center for PTSD, Crisis Hotline, the National Institute of Mental Health. All of these resources provide well-trained staff members 24/7 to help assist you and your family suffering from this disease. Thank you for watching.